This is the laboratory interpretation guide for the liver, kidney, and detoxification profile from DestinyWell. In this profile, we'll look at liver and kidney function and how they relate to how the body detoxifies and gets rid of foreign and harmful substances. We're going to talk about phase 1 and phase 2 detoxification pathways and also about blood sugar because glycotoxicity, toxicity from high glucose, is a problem that's becoming worldwide. Increased insulin resistance is a core root factor that leads to many problems from heart disease to Alzheimer's to increased inflammation, depression, migraines, and a host of other conditions. There are two phases of detoxification. In phase 1, molecules are made water soluble. This is usually by attaching other molecules to them so that they are dissolvable in water and they can go out through the kidneys. In phase 2, substances are conjugated or processed by the liver. They may be methylated, they may have sulfa groups or sulfonylureal groups added to them. They may be combined with a substance called glucuronide and glucuronidated, or they may be acetylated. So there are pathways that attach and change these chemically in order to detoxify them so they can be excreted. The liver excretes water-soluble things, but through the bile it can also excrete substances that are fat-soluble. Another pathway for detoxifying is through the skin. The skin is sometimes called a third kidney because it's an alternative pathway for things to get out of the body, from toxic organic chemicals to even heavy metals. At DestinyWell, we define laboratory ranges in a sophisticated way. We use the standard ranges, represented by the blue bar here, from each reference lab that does a particular test to define the lab high and the lab low. If you have thyroid test results that are too low based on the lab's formal norm, then you have a diagnosis of lab low thyroid function or hypothyroidism. Similarly, for glucose, if you have a lab high blood sugar of over 126 on 2 occasions, then you meet the formal diagnosis criteria for diabetes. That's needed to make a medical diagnosis. But at DestinyWell, we think that there can be a lot more nuance. We believe that there's often an optimal range based on what we have found going forward helps people to live the healthiest lives, to be the healthiest, and to avoid disease. We triangulate this with the medical literature, with other people's standards, with our clinical practice experience, and all the different data points we can get, so we can come up with what we believe is optimal for a particular test result. DestinyWell also, in the red bars here, will define a DestinyWell high and a DestinyWell low. These may or may not line up exactly with a laboratory high or low, because sometimes we think that the range can be higher or lower, or that it needs to be different. And in between the optimal and the green bar and the low and the high in the red bars, we have orange zones for moderately high and moderately low. They're not quite optimal, but they're not in the high or low zone. The most common way to measure kidney function is by testing a substance called creatinine in the blood. Men and women have different norms for creatinine because it's based on muscle mass. Creatinine is a byproduct of muscle metabolism that's excreted in a fairly consistent way. If we measure how much the kidneys are able to get rid of and how much is left in the blood, that's a reflection of how well the kidneys are working. There's a caveat that sometimes a person's creatinine will look normal if their muscle mass is low, and that's one of the reasons that women have lower creatinine than men. Our laboratory reference range for creatinine in men is 0 to 1.4 milligrams per deciliter. DestinyWell feels that the optimal creatinine is between 0.6 and 1.2 for a man, that between 0.4 and 0.5 is mildly low, and less than 0.4 is low. On the other side of the graph, mildly high is 1.2 to 1.3, and high is greater than 1.4. Now, creatinine is not just linear. So if you have a creatinine of 1.8 or 2.0, you think, well, maybe that's just a little bit up. But actually, that represents significant kidney dysfunction. Around 4 is very severe kidney dysfunction, and when you get to the area around 10, you're likely to need dialysis. Now, creatinine is tricky to interpret. It goes up with age if kidney function declines, but it also goes down with age as muscle function and muscle mass decreases. So it's possible that a very big man with a large frame and a lot of muscle could have perfectly normal kidney function at 1.4 for his creatinine. But if that person was very thin, has small frame, and didn't have much muscle, a creatinine of 1.4 might reflect kidney dysfunction. In women, a gender-neutral lab range goes up to 1.4 for creatinine, but we feel, based on laboratory ranges around the country, that a 1.2 upper limit is appropriate for most women. If a woman was very muscular or large framed, she might have a creatinine of 1.4 and be okay, but typically 1.2 is a better upper limit. We feel the optimal creatinine for a woman is between 0.5 and 1.1. Mildly decreased is in the 0.4 range, and too low is less than 0.3. 1.01 to 1.2 is mildly high, and greater than 1.2 is too high. When someone's creatinine is too low, does that mean their kidney function is too good? No, most likely it would mean that they don't have enough muscle mass, and low muscle mass is a risk for a number of problems. It's associated with decline in cognitive function, but it's also very closely associated with metabolism of glucose. Muscle is king in the metabolism of glucose, and if you lose muscle mass, then your glucose metabolism becomes challenged and often unhealthy. BUN, or blood urea nitrogen, is another waste product of metabolism. It's a waste product of nitrogen protein metabolism, and the body is always trying to get rid of it. Like creatinine, we can measure the amount in the blood to see how well the kidneys are doing their job of getting rid of it. A special situation is when you have bleeding into the GI tract. So if you have a bleeding stomach ulcer or bleeding into your colon, you will reabsorb a lot of nitrogen and falsely elevate your BUN. But most of the time, it tracks kidney function very well, and it's more sensitive to the effects of hydration. The BUN to creatinine ratio is something that we've found exceptionally helpful. A BUN to creatinine ratio of 10 to 16 is the DestinyWell optimal zone. Less than 10 is too low, 17 to 20 is mildly high for DestinyWell, and greater than 20 is too high. Our reference lab range is between 0 and 20. The best thing about the BUN to creatinine ratio is that since BUN is more sensitive to hydration effects, you can tell if a person is dehydrated. A value of over 20 suggests dehydration, and a value of 30 is often seen when patients are on diuretics and are dehydrated inside their vascular volume. I've seen BUN to creatinine ratios well above 40, mostly in heart failure patients who were treated aggressively with diuretics to try to get the fluid out of their system. Sometimes these patients were okay, but we did know that they had intravascular volume depletion. That means the amount of blood and fluid inside their blood vessels was low, and that led to an elevated BUN to creatinine ratio. I always use this when I see patients in the emergency room trying to decide what their hydration status is. It's a quick way to tell if someone's running dehydration most of the time, or if they're doing a good job with their fluid intake and absorbing and using the fluids in their cells. Now we'll move on to liver function tests. Two of the most common tests are AST and ALT. These are enzymes that live inside liver cells, and most of the time, the majority of them stay in the liver cell. When liver cells are damaged or inflamed, they start to leak into the bloodstream. The reference lab range is between 0 and 50 milligrams per deciliter. At DestinyWell, we think a value of 10 to 30 is optimal, 5 to 10 is mildly low, and less than 5 is definitely low. 30 to 50 is mildly high, and greater than 50 is high. Now, most doctors just look at AST to try to determine if you have liver damage, if the cells are leaking AST enzyme into the bloodstream, and then they look for causes of liver inflammation, infection, damage, or toxicity. But we also know that low levels of AST are associated with low B vitamins, especially with vitamin B6 deficiency. So if you see a very low AST, that's something to think of and probably check for. ALT is another enzyme from within liver cells that leaks out when there's liver damage or inflammation. ALT is actually more specific to the liver because AST occurs in the liver, but there's also a good bit of it in muscle or in heart tissue and other areas. The reference laboratory range for ALT is between 0 and 60 milligrams per deciliter. At DestinyWell, we think a value of 10 to 30 is optimal, 5 to 10 is mildly low, and less than 5 is too low. On the other end of the spectrum, 31 to 60 is mildly elevated, and greater than 60 is too high. Most causes of liver cell injury are associated with a greater increase of ALT than AST, and when this is not the case, sometimes it gives us a clue as to what's going on. Many doctors look at ALT just for elevation. They don't think it can be too low, but actually, the data shows that low levels of ALT are associated with decreases in B vitamins, especially vitamin B6. So we think that ALT can be too low. We've set our optimal range at 10 to 30 because we believe that many people who have elevation in the 31 to 60 range are starting to get liver inflammation. They're getting insulin resistance, they may be getting some fat cells in the liver, and they're on their way to increased risk of fatty liver changes and problems. Sometimes it's of value to calculate the ratio of AST to ALT. With most liver injuries, ALT goes up more than AST. But if the AST to ALT ratio is greater than or equal to 2 to 1, that suggests that the problem might be from alcohol-related liver disease. That's especially true if the GGT, or gamma-glutamyl transferase, is also elevated. GGT goes up with a number of toxic exposures, including alcohol. Another thing to know about liver functions is they go up more and more with higher and higher levels of damage. But with chronic liver disease, when liver inflammation leads to fatty accumulation and eventually leads to cirrhosis, which is a replacement of the normal liver cells with scar tissue, then there's not as many healthy liver cells around to leak enzymes. And so actually, as you progress toward liver failure, you may actually have lower and lower liver function tests rather than higher and higher after a period of time. Let's talk about the magnitude of liver function test elevations when the liver cells are injured and what kinds of patterns we see with different diseases. With alcohol-related fatty liver disease, the AST can be up to 8 times the upper limit of normal, and ALT perhaps 5 times the limit. In non-alcoholic fatty liver disease, that's the kind that comes from insulin resistance and visceral adipose, fat around the middle, AST and ALT usually don't go more than 4 times the upper limit of the lab range. Acute viral hepatitis and liver problems caused by toxic exposures often will have AST and ALT values greater than 25 times the upper limits of normal. Sometimes these conditions can even be life-threatening acutely. Chronic hepatitis C has a wide variability. Usually it's less than twice the upper limit of normal, and rarely it's as much as 10 times the upper limit of normal. Chronic hepatitis B infection has a situation where levels fluctuate. AST and ALT may be normal, though most patients have mild to moderate elevations, usually in the 1 to 2 times normal range. They go up even more when there's an exacerbation, when the disease flares up. Then levels can be 10 times or more the upper limits of normal. GGT, which is also sometimes called GGTP, is an enzyme that is found in the liver cells, but it's also found in the bile ducts that lead from the liver to the gallbladder down to the bowel. The normal reference lab range for GGT is 1 milligram per deciliter on the low end and 50 milligrams per deciliter on the high end. DestinyWell sets an optimal range of 10 to 30, mildly elevated 31 to 50, abnormal greater than 50, mildly low 5 to 19, and clinically low or concerningly low less than 5. GGT is very sensitive to toxins. Alcohol is one such toxin, and people who drink chronically to excess will often have elevated GGT levels. But functional medicine doctors also use GGT as an evidence of your toxic burden. How many toxic chemicals are you chronically exposed to, and how hard is your liver having to work to get rid of them? That's why we think the mildly elevated range of 31 to 50 is appropriate and raises an area of concern for us as to what your total toxic burden may be. Glycotoxicity, or toxicity from elevated glucose or blood sugar, is a leading problem around the world. As our diet increases the amount of sugar, we get more insulin resistance, prediabetes, and diabetes. Those diseases themselves greatly increase the risk of heart and blood vessel disease, Alzheimer's and cognitive decline, macular degeneration, damage to nerves causing peripheral nerve problems and numbness and tingling that don't go away, The list goes on and on. The laboratory reference range for glucose is 60 milligrams per deciliter on the low end and 105 milligrams per deciliter on the high end. DestinyWell has the ranges set tighter. We believe that the optimal blood sugar should be between 80 and 93 when you're fasting and you haven't eaten for 8 hours or more. Mildly elevated is 93 to 100, and clearly abnormal in our estimation is greater than 100. Mildly low is 70 to 79, and too low is under 70. We have these ranges set tight for a reason. Greater than 100 is prediabetes, and as you get into the 93 to 100 range, you may be running an average sugar that's greater than you want. When you have sugar that's too high, the sugar molecules get stuck onto all sorts of proteins and other things in the body that cause damage to them over time. Sugar can also be too low. Frank hypoglycemia, where you go into insulin shock, is actually rare, but we believe that when the values get below 80, the body is working too hard to keep them up. Usually the way it's working too hard is it puts out a lot of cortisol. Cortisol brings the blood sugar up. So if you're fasting and skipping meals all the time, you don't eat till later in the day, your body needs to mobilize sugar from other sources. So it uses cortisol to bring that up. That's fine for short-term emergencies, but if it's up all the time, your system becomes exhausted. It damages the axis between the brain and the adrenal gland where the stress hormones like cortisol are produced. Eventually that axis fatigues. It causes things like changes in the bowel, changes the bowel flora, the microbiome, it changes the integrity of the lining of the bowel, and it shrinks areas in the brain like the hippocampus that are associated with circadian rhythms and also with short-term memory incorporation. So we believe that keeping the sugar in the 80 range is probably healthier. If your cortisol fails and you're exhausted and it can't keep your blood sugar up, then you start relying on things like adrenaline and noradrenaline. So people who go to bed hungry, who are not eating enough, who are relying on cortisol, at some point the cortisol fails and they may wake up in the middle of the night hungry and starving with a rapid heart rate. That's because the blood sugar got low enough that the body's only way to get it up was to put up a bunch of adrenaline. We want to make note that our ideal ranges for blood sugar are for people who don't have diabetes and take insulin or other medicines that lower sugar. If you're non-diabetic or just pre-diabetic, not on these kinds of medicines, then getting to these ranges may be a good health move. On the other hand, if you try to get down to these ranges and you take medicines that lower your sugars, you risk serious hypoglycemia, which can cause coma, death, stroke, and other serious complications. If you have diabetes and take these medicines, you should follow your doctor's specific advice on blood sugar targets and not use these. The DestinyWell liver kidney detoxification profile is important because the liver and kidney handle and rid the body of most of the toxins and waste that the body comes in contact with. This includes chemical and biological toxins and metals from the environment. It also includes toxic metabolites and byproducts of cellular metabolism from our own bodies. Understanding the health and function of your liver and kidneys and also avoiding the commonly encountered toxicity from glucose can go a long way to improving your health. The tests included in the DestinyWell liver and kidney detox profile are the creatinine kidney test, the BUN kidney test, the BUN to creatinine ratio, the AST liver test, the ALT liver test, the GGT liver test, and the glucose blood sugar test. The function of your liver and kidneys are pivotal to how well your body can handle toxins as well as potentially toxic waste products of your own metabolism. We give you insights and details in understanding the subtleties you can tease out of these routine tests and what they can mean for your health. We show you how you can use them to assess your hydration status and also review how sugar can lead to long-term toxicity as well. At DestinyWell, we've been extremely fortunate to find some amazingly good coaches, people with backgrounds of success in varied fields who bring all sorts of resources and talent and skill to help you. These folks have many years of clinical experience, and they know how to be of assistance at every step of the way, from motivation to connecting you with the right resources to finding things that you need to get you on your journey. To learn more, go to destinywell.com/coaching to meet our team and find out how they can be of service to you.